Ballarat Health Services, putting your health first. Mild Stroke, treatment and management.
Having a stroke can be a devastating and frightening experience for everyone concerned. Having had a small stroke, you might think that you've been let off the hook, or that a larger stroke is just waiting to occur. That's not the case.
Treatment and lifestyle changes can reduce the risk considerably.
This video will help you to come to terms with what you need to do for your health and to help navigate your way through returning to work or getting back to the life that you enjoy.
So there's two main types of strokes. There's blockage type strokes when not enough blood's getting through to a particular part of the brain, and there's also bleeding type strokes where there's bleeding into the brain, and both can damage the brain cells. Doctors will usually order a scan, either a CT or an MRI, to work out what type of stroke a patient's had, and they'll also do other tests such as ultrasounds or heart monitors or blood tests to work out the causes of the stroke and how to best treat that to reduce the chance of it happening again.
After your stay, you'll be discharged home, or on the advice of our colleagues from the rehabilitation service, you may be sent over to them. Again, this is to ensure that you have the best possible chance of recovery.
I was just home and all of a sudden I couldn't conduct a conversation.
Leaving the house and I had a bag in my hand and I dropped the bag. I lost all control of my right hand.
I was teaching my class and suddenly my right arm went all fizzy and numb.
Very hard to accept the fact that I'd actually had a stroke. I don't smoke, I don't drink.
Yeah, I'd accepted I'd had a stroke. I didn't understand all the ramifications of it and what it all meant.
I was terrified about leaving hospital and going home and thinking how I would manage home.
During your recovery period, you might notice things like being mentally slow. You may feel excessively tired. Don't be alarmed. These are unfortunate things that we do see in patients who are recovering from a stroke. If you note these symptoms, please let us know or let your GP know so that he can refer you back to us as soon as possible. We are here to help.
How long can I expect the symptoms to last?
So often the effects of a mild stroke, such as weakness in your arm or slurred speech, will get better over the first few hours or days after a stroke. However, feelings of fatigue and also feeling like the thinking skills are a little bit off can linger for weeks or months.
I couldn't hold a conversation, I couldn't tell the time.
One thing I find myself is calling all my children by different names.
I found just doing day-to-day tasks like keeping my mind on it was very hard. I couldn't concentrate at all.
Things like going to the supermarket, I'd wander around going, I don't know what I came here for.
I'd get very frustrated very easily. I'd have outbursts a lot when that happened.
Some family members and friends can react quite differently to you having a stroke. Some will be very worried, others will become overprotective, and others might just want everything to get back to normal as quickly as possible. But it's important that we involve your family members and friends in the rehab process so that they understand what's going on and how best to support you, and we're very keen to get them involved in the process so that they feel supported too.
Because it was my brain, I found that people were just like, oh, he looks fine, he's presenting fine, he can dress himself, he can speak, so he must be fine, but I wasn't fine.
Lots of people won't even notice that you've had a stroke, but if it's someone who knows you well, such as a close work colleague, they might notice a few subtle changes. However, it'll be up to you how much or how little you decide to tell them.
Should I be frightened of a second stroke?
A stroke is a time when people get very frightened and start to look at their lifestyle and how they can prevent another one from happening.
I was on my own a lot, so it's quite, and you get a little pain or an ache and you think, is this it? Is this what's going to happen? Will I be able to ring the ambulance next time? Will it be worse?
I started to notice I was getting a bit of strength loss on the right side of my body. I noticed slight tingles in my face again, which set off alarm bells for me that if I didn't change something soon, something was going to happen.
The chances of having another mild stroke or a more severe stroke depend on the underlying causes of the initial stroke that you had. The doctors will put you on appropriate medications to try to reduce the chance of that happening, and also with the lifestyle changes such as diet and exercise and controlling conditions like diabetes, stopping smoking, avoiding alcohol. All those things can help to reduce the risk.
Were changes difficult?
If you think you're going to croak, then you're going to change something.
I love my job. I've been there 15 years and I love what I do. So getting back to work was a big motivation.
Having the awareness and knowing what to do about it is a big help.
Some of the changes were easy to make. I guess my smoking was the biggest one because, I was a heavy smoker.
I eat very well now instead of takeaway food and things like that. And gym, I go to gym 3 days a week and I walk every day. So,
What support is available?
So you'll probably go home soon after a mild stroke, but the staff at the hospital will refer you on to outpatient services for therapy, or perhaps to our acquired brain injury service, where you can get the help that you need to recover from the stroke.
I'd had exercise physiologists to help take care of me, make me exercise programs so I could eventually get my body back to where it was.
doing all the rehab and having sort of like a caseworker and having a speech therapist and everything like that, and going to the gym and everything like that, it was a big help.
The speech pathology, exercise therapy, occupational therapy.
So exercise plays a key role. People following stroke often have quite low physical activity function, and engaging in physical activity or aerobic exercise early on in that recovery process can assist with improving aerobic capacity, as well as improving walking capacity, endurance and speed as well.
Obviously I had a lot of the people in my life supporting me, which helped a lot. I had family, my partner and my sister, etc. So I felt that those support networks actually helped steer me in the right direction.
I was humbled actually by the amount of support that people gave me.
Getting back to work.
So most people do get back to work after a mild stroke, but sometimes we recommend a bit of time off and then getting back into work gradually. So that might mean less hours per day, less days per week, the opportunity for rest breaks and maybe doing slightly different duties at work. And the therapist can help guide you through that and to gradually build up your work capacity.
I used to work 12-hour shifts, four 12-hour shifts and then have 4 days off. I started back at 4 hours a day for 4 days a week.
When can I drive?
Usually after a mild stroke, we recommend that you don't drive for a period of time. And sometimes if there's a physical problem such as weakness down one side or a problem with your vision, you might be off driving for up to 3 months or more. However, most patients will get clearance from their GP or specialist to get back to driving sooner than that.
How has a stroke changed you?
I'm extremely lucky that I'm in this position to be able to work and to be this good and function at this level. So if it's good as it gets, I'll take it.
My diet's a lot better. I'm making time for my partner and my stepson, which I never really used to do.
Before I used to try and fit 30 hours into 24. Now I'm lucky to fit 12 into 24. But that's a good thing.
If you think when you're in hospital, when you've had a stroke, that it's all downhill from here, it's not.
Advice for others.
You've got to make choices. Do you want to be around your family and friends? You continue to enjoy the things you do enjoy, or not,
Take the support that's offered, ask lots of questions of everybody, and be kind to yourself and allow yourself to heal and take the time that you need. Everyone's different.
Ask for help when you need it. Make sure you read everything that you're given, and keep an optimistic frame of mind.
This film provides general information about mild stroke. Patients who have had a mild stroke generously offer information about their experiences and recovery process. Feel free to share the film with others, as this will help them understand what you are going through. Reduce the impact of stroke. If you or anyone you know has symptoms, seek immediate medical attention. For any medical emergency, call 000. For further information, contact Ballarat Health Services Acquired Brain Injury Service 03 5320 3728. This film was made by David Brown Films for Ballarat Health Services with funding from the Department of Health and Human Services Regional ABI Information, Training and Secondary Consultation Project.